Want to say welcome to all of the participants in the Peggy Lillis Foundation's summit this year, coinciding with the 10th anniversary of the loss of our namesake, Peggy Lillis, and to thank all of you for making the time today to up our game on communication and advocacy around C. diff awareness, C. diff prevention, and policymaking. And I'm pleased to be here as a guest presenter with a long affiliation with the foundation since its first year in working with Christian to guide the advocacy program of the organization and to build a cadre of advocates throughout the country. My name is Hans Johnson. I'm the president of Progressive Victory, based in Los Angeles, California. And I have many years of experience leading organizations and coalitions on their advocacy strategy, as well as in their donor development and their resource programs. Some of my work has been focused on state-level policymaking as well as federal policymaking. If I had to cop to a particular focus over the many years of my work, it has been on state-level policymaking and ballot measures and the interplay between grassroots coalitions and the policy process, educating a range of leaders around the country. I've worked in just about every state of the union and run ballot measure campaigns or assisted in them in more than 20 states, going back more than 25 years. So I'm very pleased to be here to share a few lessons of how to use our voice in the media, including through print and broadcast opinion pieces, and to leave some ample time for questions and to do a little bit of hands-on work with the participants in this year's summit about how to compose, place, and use op-eds to make strategic arguments and to advance the mission of your organization and coalition. That includes, of course, on public health, and we have a track record and some lessons to share from several years of applying these practices through the Peggy Lillis Foundation, both for grassroots advocates' voices in the press and for creating a national platform for Christian John Lillis as well. So I'm looking forward to sharing a few insights and to answering questions that you might have as we go forward. Any questions so far? Well, great. Let's get started. I wanted to first divide up this somewhat daunting prospect for some relative newcomers to the process of writing, placing, and using op-eds. So I wanted to break down this process into 5 essential components. The process of getting an op-ed placed has 5 essential steps to it. But there's also, it's also worth talking about what the goals of doing op-eds are. Many people ask, well, with print publications around the country on the ropes or going under, can we really count on op-eds, or do op-eds really serve a purpose? Is it worth the time put into constructing and placing op-eds to really leverage mainstream press outlets anymore? And the answer is yes. It still has a great deal of utility to go to the trouble of getting an op-ed placed for one very important reason. That reason is that having independent press outlets ratify the value proposition of your organization and the argument that you are making is a wonderful way of establishing third-party credibility and to providing reinforcement for the approach that you are taking to advocacy and to problem solving. We often feel like, as advocates, that we are out on our own and sometimes talking till we're blue in the face without a lot of respect or of traction with policymakers or other audiences. That's something that op-eds confer. it is worth the time still, in a time when print media is contracting and where it's shifting to online platforms, to still place op-eds, in part because they do get traction through those online channels also. But also, we have an obligation, once placing an op-ed or getting content that ratifies the value proposition of our argument, of our cause, or of our organization or coalition, we have a stake in circulating that message out further. So I like to say that the diminution of print media and the ability of outlets to do their own circulation of stories that we generate, of op-ed pieces that we place, puts back on us as organization leaders, as advocates, and as coalition partners, the opportunity to give those pieces greater circulation. You don't want to depend simply on the press outlet for giving it circulation. You want to depend on the press outlet for giving it ratification, but you don't want to depend on it for the circulation of the piece. So there's still a great value, even in a period of contracting hard copy press, to placing op-eds and to using the value of those op-eds that we have earned and generated to circulate that piece or those pieces through our own channels, drawing on the credibility that the independent press outlet gives to having our voice placed. Before I get into the 5 steps about placing an op-ed, I do want to just provide one example that makes this concrete for the purposes of Peggy Lillis Foundation work. And I'm holding up an example of a piece from our own advocate, Ann Fox, in Columbus, Ohio, from the Columbus Dispatch, that is called "Strengthen, Don't Sabotage Patient Safety." This piece ran in August of 2018, and it foregrounded the voice of a foremost survivor in the state of Ohio, someone who had testified before the Ohio legislature in support of legislation that we secured introduction of in the Ohio State Senate to stop and to ensure reporting of outbreaks of C. diff in long-term care facilities in the state of Ohio. It was a wonderful way to build on Ann's work and to reward Ann's advocacy with a placement in the statewide paper of record involving Ohio public policy. It built on pieces that we had placed in the Cleveland Plain Dealer and in the Akron Beacon Journal in the prior year and a half. And Ann's piece did open eyes, and it did create waves amongst those who are trying to fight transparency and the public's right to know in Ohio healthcare and long-term care environments. So this is a good example of one of the op-eds that we've placed for a survivor and state-based advocate in the Peggy Lillis Foundation's work. The 5 steps that I want to go over for composing and placing and using op-eds start with conceiving. It starts with the light bulb of an important argument that you want to convey in the local press or in the state press. What is an argument that you are making that may not have the traction that it deserves and may not have the credibility or be breaking through with the intended audiences of that argument that you need? In Ohio, for instance, in the case of the Ann Fox op-ed, we were trying to get legislation sponsored by a Cleveland area state senator with 2 other senators signed on. We were trying to get that further traction in the legislature. And we were trying to make Ohio lawmakers, as well as broad-based Ohioans, healthcare advocates, and other coalition partners in the state, aware of the fact that Ohio had taken a step back on C. diff disclosure and prevention over the past decade. Ohio actually did have some C. diff disclosure guidelines in place in 2006 and 2007, but then those were suspended and reporting requirements for long-term care institutions were canceled, sadly, in 2007. And we were trying to make people aware of a victory that we had earned at the federal level for the reporting standards and for accountability standards in healthcare that advocacy by the Peggy Lillis Foundation played a key role in winning in early August of 2018. So our message was twofold. We wanted to educate Ohioans, and we wanted to also celebrate a victory that was born of grassroots advocacy with the Center for Medicare and Medicaid Services of the Department of Health and Human Services in Washington. Not an easy hill to climb, but through advocacy and a sign-on letter generated by the Peggy Lillis Foundation in the summer of 2018, we were able to do that. So the op-ed had a two-part strategy to it. And as a result, we had to conceive of a way to get it into print. So that's the first part of a good op-ed, is having the conception of what you want to say and whom you want to say it. I'm a big believer in joint op-eds, in op-eds that pair men and women, grassroots and national leaders, or people who are clinicians and advocates, who are caregivers or people receiving care. Whatever pairing might make sense in doing an op-ed, as we did in a case in the Cleveland Plain Dealer op-ed just 18 months before the one by Ann Fox. It was a paired op-ed between Dr. Julie Regan and Christian John Lillis about the importance of reporting C. diff in long-term care environments where the disease lurks. I'm very sad to say that throughout the recent COVID pandemic and its affliction of long-term care environments, I've had many occasions to think back on that op-ed in the Cleveland Plain Dealer about how C. diff ravages nursing homes and long-term care environments. And one of the hooks that we were able to use in getting that piece published in the Cleveland Plain Dealer was to point out that the states that run from New Jersey, New York, Pennsylvania, Ohio, Indiana, and Illinois, those 6 states compose 40+% of the nursing home patients in the entire country. So one of the reasons that we were able to conceive of that op-ed and target the Cleveland Plain Dealer for its placement was not just about our own work in Ohio to get that legislation passed. It was because Ohio had a strategic role in that nursing home belt of states with a higher than average density of residents living in long-term care facilities. So it really was a particular issue of life and death for Ohioans, and we were able to use that fact as part of the conceiving of the op-ed and where we're considering placing it. So the conceiving of the op-ed has itself 2 parts. It is about the argument that you want to make and the authors of the op-ed. If not just yourself, who might be the co-author on an op-ed? Now, some publications don't accept co-authored op-eds. Some publications don't accept op-eds by more than 2 people. So just be aware that you may want to have joint authorship on an op-ed. It may make a compelling case to add a clinical voice along with an advocate's voice, or to pair up your authors in some way, but it may just be simpler to go ahead with one person. And it may ultimately be necessary to go ahead with only one person on an op-ed. That was the case with the Columbus Dispatch, which only does singly authored op-ed pieces. So the 2 parts of conceiving of the op-ed are the argument that you want to make and to elevate, and the author or authors that you want to put on the piece. The second part of these 5 parts is composing the op-ed. You want to take the time to write an op-ed that can get published. What does that mean? It means keeping it simple, telling a personal story, or at least infusing a personal argument in the story, and it means abiding by the strictures of op-ed placement. Namely, you want to keep it below 800 words. Some publications insist on keeping the op-ed below 700 words. So no run-ons, no verbosity. Op-eds are about tightness and whittling down your argument to the necessary components so that it can get placed, get printed, and have an impact. So those are the key parts of the composition phase of your op-ed. You want to be able to write the piece from a personal standpoint. You want to tell a story that weaves in your arguments, or that weaves in your story with the factual arguments, and you want to keep it short within the frame of necessary op-eds. Now, one of the things to be thoughtful about in composing the op-ed is what I call, and what journalists often call, hitting the news hook. There has to be something poignant and contemporaneous, or in the present day's news, that makes your op-ed pop, that gives it relevance, that gives it poignancy. So in addition to telling a story and making your argument and keeping it brief, you want to make sure that, especially towards the top of your op-ed piece, maybe in the first paragraph, you hit on something that's in the news that makes your argument relevant. In the case of the op-ed by Ann Fox in the Columbus Dispatch here, the second paragraph references the victory that we'd won in just the prior weeks on reporting standards with CMS and DHS. But the first paragraph of the op-ed deals with the subject of that fight over preserving rules with CMS and HHS. And it deals with the words patient protection, which are in the title of the Affordable Care Act, but which are often left out when people use the shorthand of ACA or Obamacare. They don't call it the Affordable Care and Patient Protection Act. Those words are often omitted. And we elevated that and basically said, these two words are often forgotten, but they have a real importance and it's worth talking about them. Bingo, especially when you win a victory for patient protection in the federal rulemaking process. So we used a little bit of a hook there, and that was ultimately successful in attracting the attention of the op-ed editor of the Columbus Dispatch and getting the piece properly composed and ultimately placed. So just coming back to that composition phase of op-ed writing and placement, you want to be able to make your arguments, weave in personal story, and you want to keep it short. But in your lead-in arguments, you want to have a news hook. You want to have a hook that sharply grabs onto something that's salient in the headlines of the time that you're writing it, and something that's not likely to go away immediately. Because the reality is that placing an op-ed is often a week-long to 2-week process. So you don't just want a one-day news story, you want a story that is a recurring one or has a recent major headline or major dust-up or major controversy that's just been reported on as your news hook as you are composing the op-ed. Third, once you've composed it, once you've whittled down what you're confident is a nice, placeable op-ed, it's time to pitch it. And oftentimes, you've already had some conversation or you've had some lead, maybe that you're following to get the op-ed placed in a particular print journal or in a broadcast news outlet that wants to use your argument in a print forum or in its online publication. Perhaps even offering an on-camera opportunity or an on-air segment if it's for public radio or another radio outlet afterwards, after publishing the piece. So think about where it's going to be placed. Which outlet do you want that piece to run in? And be realistic. We all may want to have a piece run in a national news outlet, such as the New York Times or Wall Street Journal or Washington Post, but in fact, a more relevant news outlet for the argument that we're making, especially if it's a local story or you're trying to influence local policy, or to have some relevance for a particular clinical leader or corporate leader who might be your joint author on the piece is to have it run locally. So it's easier to get op-eds placed in state-based publications oftentimes than in truly national publications. So keep those state publications in mind. Many of them still have opinion editors, even with the diminution of staff and work and the mastheads at local publications. There are still op-ed editors at many of those leading state journals or multiple newspapers within the state. Think about where you're going to pitch your op-ed and take the time to make the op-ed that you have written easy for the person that you want to publish it. To get to that op-ed editor, look through the website of the newspaper or the magazine or the outlet that you want to have it run. Make a call if necessary to find out the name of that op-ed editor or that person's email address, and make the approach, make the pitch of your op-ed as pleasant as possible. I'm here to help demystify what that means. Making the pitch of an op-ed that you've composed and crafted pleasant and easy to digest and consider for an op-ed editor means putting the entire text of your 700 to 800 word op-ed into the body of an email and addressing that email not simply to the general op-ed submission email address of the entity, which is fine. Op-eds sometimes do get placed that way, but you have a much better bet of getting an op-ed placed if you actually send it to the email address of the editor or editors who weigh in on the topic. So one best practice is to send it to the general address in the to field and to CC the person who acts as the op-ed editor or the people in the CC field who act as editors of the op-ed section, or the other way around. Send it to the key op-ed editor in the to field and CC it to maybe the second in command, the assisting op-ed page editor, or another person in a managing editor role who may have secondary purview over editorial or opinion content, and the general address for op-ed submissions for that outlet. And then BCC yourself, so you get to see exactly what it is that you're sending in. And while cutting and pasting all the text of your op-ed into the email, do a little intro note to the person asking if they would consider this for publication in that outlet. Don't treat it like an institution. Treat it as if you're dealing with people, because ultimately the institutions who publish op-eds are run by people. So treat them that way. Treat them collegially and ask for consideration of the piece by the person who is the gatekeeper for that editorial page. Two other tips on pitching your op-ed and what needs to be in that email. Give your piece a draft title. It won't get used by the publication, but giving your piece a title, even if it's one that you just craft yourself, 4 to 8 words long, is a wonderful way of telling the op-ed editor what the piece is about even before they dive into it. They see oodles of copy every darn day. So they don't have the time to sift through and digest your argument in detail. It needs to grab their attention. It needs to give them a slug, as journalists say, a simple phrase that tells what the story is about and catch their attention. So give it a draft title. And here's the second thing that op-ed editors really appreciate from submissions to op-ed pages: a thumbnail bio about yourself or your co-authors. In addition to a little title that you put at the top of the piece, do what's called a thumbnail bio for yourself and for any co-author on the piece with you. Or if you're placing it for someone else in your organization or someone close to you, do a thumbnail bio for them, indicating where they live, what their career has been, what their expertise or a very significant award is. Anything, two facts about that person that says what they do and makes them a relevant voice for anyone reading that op-ed. Here in the Ann Fox piece, the thumbnail bio, says Ann Fox survived a recurring infection from Clostridium difficile bacteria in 2013 and 2014. She lives in Upper Arlington in suburban Columbus and is an advocate for patient safety with the Peggy Lillis Foundation, which promotes awareness and public policies to end the C. diff epidemic. That is actually a fairly long thumbnail bio, and I'm really glad the Columbus Dispatch allowed us to get away with that because it works in the Peggy Lillis Foundation. It works in a little bit about Ann and her survivorship, if you will, as a survivor of C. diff. So that's a good example of a thumbnail bio that leverages the reputation and the name of the foundation and which honors the life, work, and struggle of the advocate personally. So those are tips for the pitching of the op-ed. Put the op-ed in the body of the email, include a short headline of your own conceiving for the piece, and include a thumbnail bio for the author or authors of the piece. Keep that very short. The whole thing, thumbnail bio, plus little title, plus content of the op-ed, should be no more than 800 words. And a brief note at the top, pitching to that particular outlet. The fourth step, as we move along on the placement of the op-ed, is its placement, is making sure that you get the piece into the light of day at a reputable journal or a reputable outlet that you feel proud of and can make use of. Placement of an op-ed, again, generally takes between a week and 10 days, and there may be as much as that amount of time between when you even get a yes from an editor about the placement of an op-ed to when it will run. And you want to then make sure that you get a link when the piece runs and that you get a heads up from the op editor if it's in the future when it might run. It's also worth asking whether it's going to be in both print and online in the outlet. Finally, I just want to ask if people think that they need tips on how to make use of an op-ed once it has run. It's up to us to circulate the pieces that we get placed. So have a plan for how you want to use it and use that op-ed in ways that serve your mission. I found over the years that op-eds in fundraising appeals to donors are a very great ratifier of the argument being made by the organization and showing the success either of that period of the organization's work or in the year-end appeal. Op-eds are a very valuable resource for fundraising for organizations. They also can encourage other voices of other advocates to do the same. It demystifies the process of getting third-party ratification for our arguments and for getting a much wider set of eyeballs and support for our positions and for policies that we're promoting, whether at the local, state, or federal level. So have a plan for the circulation and the use of the op-ed in addition to the placement of it. That's an essential fifth component of the process of getting op-eds placed and used. At this point, I want to ask, are there any questions or are there any issues that I did not deal with? I have a question about sharing the links to op-eds that we've placed, and the answer is yes. I can share those with the foundation here in just a bit. And there are a couple other ones that I think are worth sharing in the last year that I think folks will find inspiring, about threats to healthcare access and to implement the denial of care rule, which was ultimately squelched, which jeopardized the health and safety of survivors and people seeking medical care in this country, and a few other pieces that the organization has placed. And I will be happy to pass those along. I want to thank Bill Bierman for his comment. As an experienced managing editor at a publication, that he found this guidance both on target and instructive. So I really appreciate Bill weighing in from New Mexico. It's great to see you, Bill, and I really appreciate that feedback. And I really hope that folks can take the next step in doing op-eds, which is to use op-eds to generate additional broadcast attention for the arguments that we're making. I found, especially over the last 5 years, as print publications have struggled and have, in many cases, and regrettably gone under, that there's a lot more cross-platform opportunity with print-based or hard copy op-eds that run either online and or in hard copy in daily news outlets. To wit, we have an opportunity for advocates to get on their local broadcast television stations and on local radio, particularly public radio, with commentary that gets picked up, gets read, gets digested by the broadcast editors and the crew in those broadcast outlets, reading what's in the print outlet, reading what's online in that local news outlet, and then choosing subjects for on-camera appearances or on-air talk shows. It's very important to put those additional outlets on your circulation list when the op-ed runs. Oftentimes, good op-eds can give you 3 bites at the apple, because your op-ed in a daily news outlet may run online on Thursday. It may be placed in hard copy in the Sunday print edition, and you may be able to then put out that Sunday print edition in another e-blast that you do on Monday morning that then gets picked up for additional media appearances or opportunities that draw on or give further traction for the argument that you made in the op-ed piece. So think about the multiple bites at the apple that you can take by making the investment in a good op-ed placement. It has lots of benefits if you leverage it smartly and you go through the 5 steps of placing and using it adroitly, and it can have a lot of dividends for your organization, for your cause, and even for your own advocacy as you go forward with trying to pass legislation or build a base of advocates or coalition partners at the local or state level. Thank you again for your time. I'll be happy to pass along those links here in the aftermath of this presentation. Thanks again.